Yeah, and I think part of the issue is people don't even realize that uh, that medicine isn't necessarily a foregone conclusion, and people have different philosophies on medication and on medicine, and how far people will go with their medicine. So sometimes you'll hear about people where they're saying, "Oh, yeah, my auntie just went to have her uterus removed."
Mm-hmm.
Right? And you're kind of like, whoa, wait, what would you have to do to, is there another option? Right? Kind of like when we go to the doctors
Mm-hmm.
and we say, actually, I want to get a second opinion. And in sports, right? They're like, actually, no, let me get a second opinion. Actually, that's how we got Kawhi. Kawhi got a second opinion and was like, yo, I'm out of there. So it's important for us to realize that we have to respect people's philosophies on medicine and how they see it. So, for example, just in my framework and the way I see it is, all medicines have side effects, right?
Mm-hmm.
And nothing is perfect. There isn't like a silver bullet that cures all things. And so I'm weary when people are telling me about this vaccine or other things, and they're not telling me about what's behind the curtain. So these are things we have to be mindful of.
Mm-hmm. Yeah, and I think that even some people that I talk to that aren't necessarily medically trained, are like, man, that sounds like very homogeneous messaging, right? Like, I'm 100% sure, the way out of a pandemic is much more nuanced than take your vaccine.
Mm,
Like, if every other problem in society is more nuanced, then why isn't this one? Right?
mm-hmm, mm-hmm.
And, how can you continue to say it's safe and effective if, there's 13,000 deaths in the VAERS database, which is the adverse events database, right?
Mm-hmm.
Like, is that really true? Like, are we really? Oh, yes, no, vaccines are always safe and effective and it's good for you. I think the other thing that we need to really remember when we're thinking about treatment is that, there's a broad, the population is very different. What's good for you might not be good for me based on, our history, our comorbidities, our treatment past, different factors that are going on, so it's never, one size fits all. And so I think that, that's called personalized medicine. It's where you take something and you look at the person's personal situation and then you customize a treatment accordingly.
Mm,
So, the fact that we're doing one size fits all medicine in a time when our level of sophistication is quite advanced is very curious. And the other thing too is that if you were to look at, things that alternate treatments, whether they're nutraceuticals or, things like ivermectin or fluvoxamine or other things that have now got randomized phase 3 trial and against standards of care and do show benefits in terms of the clinical endpoints that we were talking about, where they have measured things like, not only cases, but severe disease and death, and actually have shown benefit. We're not really acknowledging that, and we're saying that that doesn't have a lot of evidence, and yet we're looking at these vaccine trials that were really only done in a very in healthy patients with a questionable endpoint, without proving that there was improvements in severe disease and death. And we're saying that that's good and that's the only solution, and there's no other solution. And yet we know that these other things exist with higher levels of evidence and burdens of proof. So it's very curious. I would think that even the average consumer should start to ask questions whenever they hear something that it's just only one solution for everyone. In those phase 3 trials, they didn't actually include pregnant women, for instance. They didn't include the large ones that were done, didn't include children. They didn't include people who were COVID recovered that had pre-existing immunity, and they didn't include immunocompromised people. And then, the moment that these trials were finished, the campaign rolled out, and, they were marketing it to the elderly, the frail elderly, as because they were at higher risk. Well, those people weren't even studied,
mm,
and then they made a case for, women who were pregnant were at higher risk than non-pregnant people. But if you consider that a number of the people in that particular study were obese, and obesity is a risk factor, and that pregnancy itself is a risk factor, then the differences between the pregnant and the non-pregnant group in that particular study were really, minimal. So I don't think that you could make a good case for women being, but then they immediately started treating every single pregnant woman. And I was just reading the Ontario Public Health bulletin that was saying, and now women can get booster shots because they're in a vulnerable group. And the vaccine has never been tested in women in a randomized controlled trial. And when I say the emphasize randomized controlled trial, it's because it's never been tested in a way that can prove that it's both safe and effective for that population. Using it in real world studies and then looking at the data like they have been doing for a CDC is just so open to manipulation and bias and error that, when we're thinking about the lives of unborn children, it just doesn't make sense that you would be that cavalier or casual with your scrutiny. I think, a good way of thinking about this is like if you're in a war zone and, there's enemy fire, enemies all around you, and you want to clear the civilians out of a village, what you do is you go forward and you clear the area and you make sure that there's no enemy there so that when you bring the civilians through, they'll be safe. So what we've done with these vaccines is we've basically kind of taken this position where we say, I don't see any enemy fire, so yeah, pregnant women, go ahead. Right? It's like we're not taking the time to clear. It's not what you do in medicine. Because the adage is do no harm, then you have to prove safety before you give it. So, we've adopted this very strange thing. And I think it's because governments are actively marketing to their people where they're like, if I don't look properly for safety and therefore don't see it, then I will say that it's safe because then I will get them to use the vaccine. Do you get it?
Yep.
So it's minimizing the risk. It's you maximize benefit, you minimize risk in business when you're marketing something. And so they're minimizing the risk by not looking and not doing the proper due diligence. And they're maximizing benefit by extrapolating from surrogate endpoints.
Please subscribe and hit the bell to stay up to date. If you liked or disliked the snippet, give it a like and share your 2 cents with us in the comment section. And remember, 6 cents makes change.